So this is important. It's really important for you to know that there is a lot of trauma training happening in the world, and a lot of trauma-informed approaches happening in the world with very little evidence to see if it matters. So my goal for you today is to, A, remember that, and give you some ideas of data you could be looking at when you're working around having a trauma-informed building or district. So the systematic review of data about trauma-informed approaches and how this is working in education, besides it, what it says is that we don't have anything to demonstrate that it's making programmatic changes or systemic changes or outcome data or outcome changes for students. And it's really unclear what exactly it means to be trauma informed. So what I want you to remember is we have to measure what we're doing around trauma. We can't just throw some trauma training out and be done. We really need to know what that trauma training needs to focus on, who it needs to focus on, where we need to provide support, and if it mattered, right? If schools are going to spend time and money, I guess time is money. If schools are going to spend time and money on this, we need to know if it matters, if it works. I, of course, think it matters, but I'm not researching whether or not it matters. And so we're going to have to rely on each other in the schools to start to really get deep into the data. So there are so many reasons why we need to be working around trauma, right? The reasons are all there. So suicide's the second leading cause of death among kids. There's a 63% increase in depression. There's an 80% increase in teacher stress. There's a 46% of students in our country have had at least one adverse experience, and that was way before the border problem. We have a steady problem with opioids. We have a problem with electric aggression. And I want you to think about here for a minute, what is the need in your district and community? What does your community data say? I want you to really think about that for a minute. So, and if you don't know what your community data says, I want you to start thinking about how you could find out. And ideally, this is done at a district leadership level. Ideally, there's a district leadership team driving the work. Earlier, I mentioned the integrated systems framework, right, where we're including mental health. And ideally, all of this work is driven from a district leadership level, a district leadership team where they have a focus about wellness and social emotional behavioral health for kids. And they're looking at what data says. So maybe transportation is getting in the way of is causing kids to be absent in your community. Maybe there's an asthma problem in your community. Maybe there's an opioid problem in your community. Maybe there's a meth problem in your community. Maybe there's a large section of people who don't have jobs, are unemployed. And we know that that lack of employment and crime are connected. So what does that say about our crime and what regions of our community are looking at those things? So I want you to remember, you've got to have data to show that what you're doing makes any difference. And you need to make sure that you're looking at your community data to help make those decisions. So the data is your driver. And remember, just like when you stand on a scale, data is not good or bad, it's just data. It just helps put the problem in the context of the situation as opposed to the problem being on the child or the family. It just gives us information to help make decisions. So hopefully you could look at your student response data and it tell you where you need to intervene and what you need to measure for impact. This is, in my experience, it's going to be a hard conversation to have, because we really need to look at where our holes are in terms of supports and services, And in order to look for the holes, you're going to have to identify what's in place and whether or not everything you have in place is working, and whether or not it's because Kate went to a workshop and brought an intervention back and she liked it, and so we did it in our district, or did we decide as a district that this is what our community tells us we need? So I really want you to start putting that hat on. So I have a couple of slides in here about we're making sure that we seat this within our multi-tiered systems of support. I'm not going to spend a ton of time here because I touched on it earlier. And I think I mentioned to you in the keynote to make sure that you keep it within your framework. But it's also important to remember that this work came out of the public health framework. So this wasn't a dude at the University of Oregon making stuff up. This was a dude, Hill Walker, at the University of Oregon working with a school district that did not have things aligned and connected and organized and systematized. And so I imagine him sitting at his desk thinking, why don't we use the public health framework in education? And that's how this all got started. So the public health framework is what we're using. So if you have any buy-in issues in your building, this is a good thing to remind people that someone didn't just make up this triangle for PBIS. So when we have a focus on social, emotional, behavioral, mental health, we want to organize our resources. I mentioned a gap analysis. We want to get to kids early based on our data. We want to use interventions that are likely to work, so hopefully evidence-based or in the process of being evidence-based. We want to have systems in order to support our adults, and we need follow-up after we have training. So we need to make sure that it's not a train and hope model. So of course, you know that this is a framework for decision-making. So I know we're not in tier 1 training, but this is always a good time to point out that PBIS is not about rewarding kids. PBIS is having a structure for how you make decisions of what you need to do for all kids, some kids, and a few kids. It's the structure of how we make decisions about how we layer interventions. And acknowledgements are part of that conversation, but they aren't the conversation. And it's super, super important for us to make sure that we keep reminding people of that. Especially as we look at how we're going to go back in the fall, because you could very unintentionally spend all your PBIS tier 1 time thinking about how you're going to reward kids virtually or in a hybrid setting. And you don't want that to be the main focus. You want the main focus to be, what are we going to do for all kids? What's our data say we need? What are we going to do for some kids? And what are we going to do for a few kids? And so we really need to make sure that as we function through the pandemic, that we don't get sidetracked and make it all about acknowledgements. So trauma really should inform your triangle at all 3 levels. It's not any different. We're still looking at what do all of our stakeholders, teachers, staff, families, and students need to know about trauma. And then what kind of support do we need to give staff, students, teachers, families? What kind of extra support or second layer of support do we need to offer them? And then what's a third layer of support we need to offer? Just as a reminder, tier 2 is always a second dose of tier 1. Tier 2 is a second dose of tier 1. You cannot give kids tier 2 interventions if you haven't given them tier 1 interventions, because by definition, tier 2 is a second dose. So if I go to the doctor and get antibiotics and I come back 10 days later and he says, how are you feeling? And I say, crappy. He's going to say, did you take the first round of antibiotics? And if I say no, he can't give me a second round because I didn't take the first round. So we have to make sure that we're really looking at how we're providing those supports. So as a side note, this is the slide that I use to talk to staff about what a PBIS universal team does. And so this could be your guide for how to approach things within the pandemic. And I'll On our Midwest site under coaches, we have a PowerPoint that takes each one of these and breaks it down by this applies everywhere, this applies in hybrid, this applies in remote learning. But I use this slide to make sure that people understand that you're not all party planning on your tier 1 implementation team. In fact, we're going to have teaming and leadership with a vision that's informed by your stakeholders to define rules and routines, usually done through the matrix. We're going to have a system for teaching, a system for feedback and acknowledgements, a way we all respond to inappropriate behavior, and we're going to have a data-based decision-making process. That's what our tier 1 universal team should look like. And this, we can't skip this data-based decision-making process, especially when we're talking about trauma. So just as a reminder, our goal here is to make schools more effective and equitable learning environments. And we do that by having predictable, consistent, positive, safe, equitable environments. And I have, I'm just going to go through these next few slides kind of quickly, but think about this. We show predictability and consistency in a school by having maintaining usual routines, having consistent messages. We show consistency by setting clear, firm limits. We have logical and restorative rather than punitive kinds of responses. Consistency and predictability within a PBIS framework come about when we warn kids if they're doing something out of the ordinary. It supports all kids to feel safe physically, socially, emotionally, and academically. It looks at kids in a holistic manner, taking into account relationships, self-regulation, academic competence, physical and emotional well-being. And so there are, of course, advantages to PBIS. So when you have this in place, when you have this framework in place, you can more easily begin to weave in the work around trauma. So it will help you, having that framework will help you promote your decision-making. It should help improve climate and learning environments. It should help support adult behaviors. It should leave happier and more at peace. And it should reduce punitive approaches. It should always be reminding us that being punitive with kids who have the most chronic behavior problems is one of the least effective ways that you can change their behavior. And we should see a reduction in referrals and better academic performance. I do want to make sure that we expand our thinking when we think about PBIS to the integrated systems framework piece of the puzzle. So I just think about PBIS getting bigger with an integrated systems framework. They're not separate from or different from. It's really just making sure that our lens is including mental health. About 80% of the kids who have mental health conditions aren't getting treatment, and 1 in 5 youth have a mental health condition. We know that school is the mental health de facto mental health provider. We know that suicide is the leading cause of death. I'm not going to be able to quote you the study, but the study is actually recently showing that, studies are actually recently showing that kids are reporting being more stressed than adults right now. And factors that impact mental health happen around the clock, around the year, right? They're not just like teachers don't work from August to June. That's ridiculous. Teachers work year round. The mental health problems don't stop just because maybe they're not coming to brick and mortar. And it's really challenging to be in this environment and address these concerns. So that's one of the reasons we really need to make sure we're having partnerships with our mental health providers. If you are interested in finding more information, there is a link in the PowerPoint to the guide for advancing educational effectiveness through an integrated systems framework. And in that guide, you'll see that this work about integrating mental health is not new. It just takes a while. It's a big undertaking to get all of this moving in the same direction. Getting mental health and schools moving in the same direction is a big undertaking. So it started really in 2002 and has continued to work through 2017. And now we're starting to have demonstration sites where we can show data that demonstrates how this is all working and how important it is. ISF defined. So this is what an integrated systems framework looks like within your PBIS framework. It's like this big lens and we're just widening it a little bit. So we're still using tiered prevention logic. We're still looking for kids who need support. We're still looking for what kids need, what all kids, what some kids and what few kids need. We're still looking for that. But we're going to start having, when we're integrating our systems with mental health, we're going to begin to cross system problem solving teams. So what that means is mental health providers start being part of our teams, of our PBIS teams. They're part of our problem solving team. They're part of our tier 1 team and our tier 2 team. They're part of kind of the fabric of our building as opposed to being separate from. We want to begin making sure that data is driving what interventions come into our schools. So if you need trauma kind of work, if you need cognitive behavioral therapy supports in your building, that should be identified through data, and the district level team should be deciding what interventions are brought in. So as much as I love yoga, I would say, I have said, somebody said, let's bring yoga into our building as a group. Let's have a yoga group. And I unfortunately said something like, what data is telling you that you need a yoga group? And how are you going to know it matters? Because you don't want to skip that part. And we want to have active involvement by youth, families, and other community stakeholders. So at that district level, how are we getting parent voice? And how are we getting community stakeholder voice? If we don't have their voice, it is impossible to create an equitable system. We have to have our stakeholders' voices so that we can make sure that we are listening more than we're talking when we're asking for feedback from our stakeholders. So there's some slides in here about alignment. And I'm just going to point out to you that when you focus on alignment, we really start getting into whether or not our system is sustainable. So it means that if the world's best school psychologist leaves your district, you could still function and you can still serve kids, right? That we have everything sustainable and that we're efficient as possible. So I don't know about you, but when I was a school social worker, it would not be uncommon for me to be seeing a kid individually, for the Youth Service Bureau to be coming in to see a kid individually, and then teachers doing things with that kid individually. Like it wasn't aligned and it certainly wasn't efficient. So we want to start thinking. The 3 types of data we're going to talk about include outcome data, perception data, and fidelity data. So as a side note, if you are a data geek, perception data can fall under outcome data. I do recognize that. We have them separated in these 3 buckets because we think they're easy to talk about this way. So outcome data is what's the impact of what we're doing. The perception data is, do stakeholders see the impact? And fidelity data is, are we doing what we said we're doing? Are we doing what we said we were going to do? So just like at the end of an FBA BIP meeting, when you're writing a behavior intervention plan, you should, when you revisit it, you should always ask if it actually got implemented. The same is true with fidelity data and trauma. So outcome, perception, and fidelity. And if I were queen of the world, we would look at all 3 of these in each district. But maybe we need to lower the bar a little and start with 1. Just getting the conversation started that we need data might be a great place to go. So let's talk about these a little bit. So tied to the tiered fidelity inventory, the TFI 1.12 is about discipline data. And ideally, we mostly know this, that Tier 1 teams have instantaneous access to graphed reports summarizing discipline data, and it's organized by frequency, location, time of day, and by individual student. So data is driving our team meetings. Precision problem statements are driving our team meetings, not party planning. Data is driving our team meetings. So, so discipline data, if you are going to enhance the discipline data piece to be more trauma informed or to include a bigger trauma lens, you might need to consider some new data points and expand those a little bit. So what most of us use are office discipline referrals, suspensions, expulsions, attendance, those kinds of data points. But when you put your trauma hat on and you're talking about data, we want you to consider to really expand your thinking about what kind of data you're using. What kind of data are you using to measure social, emotional, mental health kinds of points? So could you begin measuring and tracking the number of student nurse visits that you have? So, you know, a lot of kids who are internalizers, right, who have high levels of anxieties, often go to the nurse, or they often ask to go to the office, or they may have some pattern that we need to look at. Your number of nurses visits, as well as your number of counselor visits, should be something that we start looking at. So not just ODRs, office discipline referrals, suspension and expulsion, and attendance and tardies, but how often are kids visiting the nurse? How often are kids visiting the social worker, the psychologist, the counselor? And then you can also begin to look at universal screening data. So now is not the time, if you are going to be hybrid or virtual, to start doing a big universal screening project. But now is the time. It's perfect timing to create a few screening questions that you ask that are connected to trauma. So for instance, the PowerPoint I mentioned earlier under our Coaches Network page from our first Coaches Network meeting has some examples of this in there, but asking high school kids some SEB, social emotional behavioral questions twice a week can be a really good screener. It can tell you who is self-identifying. Doing some questions regularly with families, setting up a symbol or a sign that kids use to tell you they need help. So I can't just say out loud or in chat that I'm worried my dad's gonna hurt my mom or my dad hurt me, but we need to have some sort of way to screen, and maybe that's by one of the ways of doing that might be by having some sort of sign or symbol that kids know and use. So screening data can be small. You don't have to jump into an entire screening process. So decide what you want to look for and then ask the questions and then use the data to drive what decisions you're making. We could also start looking at the number of restraints. When we're thinking about expanding our trauma lens, we could start looking at teacher attendance. And I mentioned earlier this morning that teacher attendance is a little tricky because teacher attendance might get worse before it gets better if we're focusing on wellness and self-care. Because people who practice good self-care don't go to work when they're sick, right? You stay home and take care of yourself, right? But we all have probably lived in buildings where you went to work sick because that's what was expected of you. So that could be one. The number of hospitalizations. I have a small district here in central Illinois that had an obscene number of psychiatric hospitalizations. And it wasn't until we got that district team looking at community data that we realized like we needed to do something about all those hospitalizations. What was prompting them? How could we intervene? We could be using outcome data like student safety screenings, like crisis calls that we make. And we could also be looking at restrictive out-of-district placements. So what I want you to do is I just want you to see if you can expand the outcome data you're looking at. Can we begin to open it up a little bit more to include social, emotional, behavioral wellness? On a side note, you know, there are plenty of places now that have gotten rid of or are getting rid of the office discipline referral and are moving to time out of instruction forms. One of the great things about a time out of instruction form is it definitely emphasizes to all of your staff that an office discipline referral is not a consequence. What happens as a result of the office discipline referral is the consequence. So the office discipline referral is a tracking sheet. It's a data tracker. And if you change that to out of class time or missed instruction time, you could begin to catch nurses visits, you could begin to catch counselor visits, you could begin to count outside therapy visits that happen during the school day. So you could begin to expand that way. So in chat, oh no, I'm not gonna have you write it in chat. Just reflect for a second. Just reflect for a second about a few outcome data points which you might be considering using. Let's do that. That's kind of a more clear question. What are some data points that you might consider using? Just reflect for a second. That's code for Amy's going to take a drink. Yep, somebody did put in chat, classroom evacuations due to outbursts, right? Absolutely. So there's kind of a couple of good things that would happen if you tracked the classroom evacuations, right? It's going to help us narrow down which kids are having really high level needs if we haven't already, which we probably have. It's also going to give us information about whether or not we're supporting the teacher enough. That kind of data can really help us say, oh man, we really need to give that teacher more support in the class, or we need to have somebody in there helping provide support to the teacher so de-escalation can happen more quickly. Outcome data could be, we're going to go to family surveys next, and that's going to be under our perception data. So thank you for putting that in the chat box. So let's talk about this perception data. Parent screenings and parent surveys, family surveys are a great way to get perception data. So in your PowerPoint, there are hot links, I think that's what that's called, where if you click on it, it takes you to the assessment. So we can get student perception data, teacher perception, and family perception data, and you don't have to use these tools, but that you could reference them, you could base things off of them. We do need to be gathering student, teacher, and family perception. And you know, it's interesting to think about this a little bit differently. So instead of us having a team where we decide that this is the survey we're going to give families, maybe we need to ask some families to come in and help us decide what to do about getting family perception. Because otherwise, it's just continuing the, we are mostly white in education. It's continuing the white institution, right? It's continuing the white way of doing things. I think probably the best example, I mentioned this in the keynote, of really thinking through parent perception is the Nice White Parents podcast. It is, like, I'm telling you, it was one of those podcasts I stayed in my driveway and I stayed in the Menards parking lot because I didn't want to miss it. Because I was listening to it live and I just was like, I can't get out of my car. I have to understand what they're saying because I hadn't thought about it that way. So there are lots of different ways that you can do family perception. Teacher perception, You can do school climate surveys. You can do, you can do school climate surveys. You can do self-assessments on PBIS apps. Everything on PBIS apps is free. And you can also look at using the Arctic scale, which is the attitudes related to trauma-informed care. And that could be, if you might want to look at the Arctic scale, but you also kind of have to be aware that that costs money. So we want to get student outcome data. We want to widen our lens about what data we're looking at and who's looking at it. And we also want to get perception data from all of our stakeholders. The podcast was called Nice White Parents, and it's with the Cereal podcast, not like Cheerios, like S-E-R-I-A-L. I only say that because at first I thought it was cereal. So here's a couple of student questions that we could ask. Remember, when we're looking at a trauma-informed school, all of our points are that we are safe, predictable, and consistent for kids so they can learn. So what kind of questions do we want to ask? Teachers treat me with respect. School's a place I feel safe. I know an adult at school I can talk with. You can come up with your own questions. I have a large high school that took that student climate survey and added some questions, and we found out some pretty interesting things, like the hallway upstairs on the north side was not safe. Kids did not feel safe there, and we would not have ever known that if we hadn't surveyed them. So staff, we could begin asking questions like, you know, we're doing this in some Texas schools. My regulation, my ability to calm down, directly correlates with a student's ability to calm down. Like, is that what teachers think? We need to know, and we hope they do think that. We hope that teachers understand and have been educated enough about trauma to realize that it is humanly impossible. If my brain is not regulated, it is impossible for me to get a kid's brain regulated. Humanly impossible. So we need teachers to remember and know and understand and be supported with their regulation is going to help, or the kid's regulation is dependent upon the teacher's regulation. Do our teachers know that you can control your behavior when the stress response is triggered? Do they think it can be, or do they think it can't be, right? Do teachers really understand that when you are in fight, flight, freeze, or faint mode, that you are actually functioning from a different place in your brain? And those decisions may not be decisions you would make when you are calm. And do our teachers know things like a student needs to be regulated in order to access their cortex for decision making? Do our teachers know these things? We need to survey them and ask them. And if they don't know them, that's the perfect way to find out what kind of professional development they need. So we're going to move to Fidelity Data. So we did the outcome data, right? So that's the widen your lens to things like nurses' visits and community data. We did the let's get perception data from all our stakeholders, and now we're going to just look at Fidelity Data. So when we look at Fidelity Data, the 1.14 piece on the TFI, what we want you to consider doing is enhancing that a little bit. So we have a TFI walkthrough with some trauma-informed enhancements that you could use, and it doesn't change your score, it just gives you information. And we also have a classroom practices observation tool that you can use that can help with that. And I'm going to talk about that in a minute. So we suggest you use the trauma-informed companion guide for reflection and planning only, doesn't impact your score. And on our website, the directions how to get to the materials are at the beginning of this PowerPoint, and that reflection tool is in Module 6. And it goes through and gives you the opportunity to look at things like, does your team have people with knowledge on it about trauma? Are you considering all of your action items through a trauma-informed lens? Are your action steps about becoming trauma-informed on your integrated plan? Meaning you don't have a trauma team and a PBIS team, they're integrated. Do our problem behavior definitions in our building create consistency and safety? Do our discipline policies include things like regulation, relationship, and teaching skills and promoting safety? Is everybody getting professional development that they need on trauma? And are faculty provided data used to monitor trauma-informed care, and do they get input? Are we looking at student and family perception data? And then are we making sure that we're looking at, when we're looking at database decision making, that we have the trauma lens on? So I'm gonna keep going here to show you that in addition to those trauma questions, in addition to enhancing the TFI, we do have a staff walkthrough tool. And what I want you to do, I want to encourage you to create your own. You don't have to use this one. But it can be really helpful to know with your staff, what skills have you taught students to use for regulation this school year? This question could be, have you taught regulation school strategies this school year? It could be things like, what adult at school could you talk to if you needed help? Or it could even be, do you have an adult? Have you as a student been reminded to use a calming skill in the last 2 weeks? So it's like just doing a little dipstick of, it's just a quick data point. Like, are we doing what we say we're doing, right? Because we want to be looking at fidelity. And fidelity is, are we actually doing what we say we're going to do? So there are some tools that we're not going to have time to look at during the session, but there are some additional fidelity tools that I would really encourage you to look at. The Trauma Sensitive Schools Checklist and the Wisconsin Trauma Sensitive Schools Fidelity Tool. And if I were queen of the world, this is the one you would pick, the Trauma Sensitive Schools Fidelity Tool from Wisconsin, because it's really thorough and it's really easy to understand. And it can really help your team make decisions. So I'm going to move to an annual evaluation. So does your Tier 1 team document fidelity and effectiveness about Tier 1 practices? That's what annual evaluation says on the TFI. And is that data shared with stakeholders? And is it in a usable format? So when you're thinking about annual evaluation data, what are you looking at? What are you looking at the end of the year? If you didn't do the TFI in the spring because of the pandemic, it'd be really good to do it soon once you get back, because your TFI action plan could really guide what your Tier 1 team is doing. I did have an assistant superintendent say, we can't possibly focus on PBIS right now. And my response is, thanks, Heidi. My response is, PBIS should help you ask the right questions and help you make data-based decisions about what kids and families and your staff need. So at the end of the year, or in pandemic world, maybe at the beginning of the year, look and see how you're doing with fidelity. And make sure you're sharing that with your staff. So this is a lot like check in, check out. If you have all of your staff do check in, check out at Tier 2, and you don't ever tell them if it works or not, they're gonna stop doing it. So when you have a kid get check in, check out, the teachers need feedback like, hey, we have 15 kids in right now and 11 of them are responding. Thank you for that. Thank you for doing X, Y, and Z. We really appreciate it. It's working. Teachers need to hear that. Otherwise they think it's not working, or they don't know if it's working. And if I don't know if something is working that takes extra energy, I'm probably gonna stop. So make sure you're communicating that data with both your staff and with your families. So let's think about fidelity data points that you might want to look at. And then what you could do is you could create an evaluation plan. So you don't want to just stop at, we're going to collect X, Y, and Z data points, right? So we've talked about outcome data, expanding your vision to include bigger things, community, nurses, counselors, those kinds of visits. We've talked about having perception data from all our stakeholders, and we just talked about fidelity data. So picking which ones, 1, 2, or 3, or all, some, is a great plan, but you can't stop with just picking your data points. You have to develop a schedule and a process for how you're going to do it. Because if you don't develop a schedule and a process for how you're going to do it, it will get lost. And once we have that schedule, we have to decide how we're going to action plan around what we learn. So on our website, there is a sample plan. Actually, there's a slide down too that's going to be a sample plan. But so some tips for developing your plan would include make sure it matches your school. Make sure it matches the context of where you live, work, and breathe. Right? You don't need to take on a plan and measure other people's data points. Measure what makes sense for you. Do what makes sense for you. What's manageable and doable. Of course, use different formats. Make a format that works for you. One of my closest colleagues who's done all the trauma work with me, we say we're like each other's yin and yang, because she's a detail person and I'm a big picture person. And what she puts together, I'm always like, whoa, 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 I got to have some pictures in there to know what you're talking about. We have to make it work for us. And the same is true with your evaluation plan. You could start talking when you're creating your evaluation plan about what really got you interested in trauma and what are the needs in our school and our community. This top portion of the sample plan I'm about to show you, I'm only going to show you part of it, but the top portion of it, when you look at it, is intended to document your full plan of how and what you're going to look at and how you're going to measure it and when you're going to measure it. And then the bottom part is meant for you to put your data in. The link to that document is in your PowerPoint. So you see here, it's like we're going to identify the evaluation category. We're going to determine what questions we want to ask. We're going to figure out what data we're going to get that from, when we're going to collect it, and how we're going to collect it. Make this work for you. This doesn't have to be complicated, because the 3 big messages are: this data collection and trauma work needs to fit within your current framework. It cannot be siloed. Do not have a PBIS team and a trauma team. Have a team that's focused on social, emotional, behavioral wellness of all kids in your building. And make sure you have people who are trauma informed on there. So make sure it's not siloed, which also might have been one from the keynote. Number 2, look at kinds of data that you could use. We talked about outcome data, we talked about perception data, and we talked about fidelity data. And then we're ending on what's going to be your plan for how you do all of this. So go bigger than we should look at nurses' room data. Okay, well, how are we going to do that? Who's going to do it? When are we going to do it? What questions are we going to ask? So make sure you create a plan. So the big takeaways here, we're not going to have time to do another breakout, but the big takeaways here are: there is a need for trauma-informed work, but there's almost even a bigger need to determine what impact it's making, what it actually means. The school-wide PBIS framework, along with the integrated systems framework, is the way to install trauma-informed practices. This means data and systems with practices, not just interventions, but data and systems to go along with it. I always explain it that data is how we use decisions, systems support grown-ups, and practices support kids. So we need to have all 3 of those in place. Your data should be determining who, where, when, and what you're going to measure in terms of impact. So ideally, that's done at the district leadership team level. And I'm pretty sure on PBIS.org, which is the National Center's website, which everything is vetted that gets written and posted on there. It's a great place to look, PBIS.org. I'm pretty sure there's a section on there about district leadership. And if you look and there isn't, I'll show you my email again. Email me and I'll help you find it. And make sure your evaluation plan, ultimately, our aspiration here is, ultimately, your evaluation plan around trauma looks at outcome, perception, and fidelity. 3 buckets: outcome, perception, and fidelity.
I do have a couple of specific questions, and then if there's some further follow-up questions, folks, it's all right if they email you to.
Yeah,
okay,
absolutely.
cool. So one of the questions came from Cameron, who asked that the Tier 2 team they've talked about universal screening, but they've decided not to collect that data because they haven't developed the supports yet. Do you have any thoughts on that or suggestions about how to move forward with that?
So Cameron, I'm going to go with it. You're talking about a formal screening process, like using a specific evidence-based tool and that approach. Type in chat if that's not right, and then Heidi, will you let me know? Yeah. But I'm assuming you're talking about a formal process. So the first thing I would say is you don't want that responsibility to fall on your Tier 2 team. You want that decision to fall on your district team. Your district team should be guiding decisions about formal universal screening for lots of reasons. There's going to have to be funding involved. There's going to have to be time for staff involved. There's going to have to be a decision about what tool you use. It's going to need to be more than likely a district-wide tool. And you're going to need your school board members and all of your administrative team to be on board with doing universal screening. Otherwise, it comes back and bites you. Sometimes universal screening freaks people out. They don't recognize that it's just like vision and hearing screening. We're just trying to find kids who need help. But I would say that I'd shift that off of your team's plate. And then your Tier 2 team can focus on getting interventions ready and steady and done with fidelity. So when we do identify kids with a universal screener, we're going to know what to do with them. And in pandemic world, your Tier 2 team could be preparing what they're going to do when your Tier 1 team does some universal screening questions that are informal. So I would shift that off your plate and focus on getting your Tier 2 interventions up and running with fidelity, especially now that we know all of that's changing with the pandemic. Did that answer the question?
Yeah, she said that's perfect. So thank you for that.
So I'm not sure if you know this, but the the Department of Ed at the federal government level regularly assesses if we are doing what we are saying we're doing at the National PBIS Center, and whether the hubs of the National Center are doing that. And our project officer's name is Renee Bradley, and she recently shared this from a coworker. So I'm going to read it to you. What if 2020 isn't canceled? What if 2020 is the year we've all been waiting for? A year so uncomfortable, so painful, so scary, so raw that it finally forces us to grow. A year that screams so loud, finally awaking us from our slumber. A year we finally accept the need for change, declare change, work for change, and become the change. A year we finally band together instead of pushing each other apart. 2020 isn't canceled. Instead, it's the most important year of them all. So use your data when you're thinking about going into 2020, the fall of 2020. And I appreciate you all coming to this session. I hope you take away something that was helpful.